For the Chancellor, Wednesday will be another budget under a shadow cast by COVID and a deepening cost of living crisis.
Mr Sunak, how will you help families struggling to pay their bills this winter?
Rishi Sunak says his budget will protect livelihoods and put more money into transport, health and further education. But he was less forthcoming about a rumoured return to some COVID restrictions in England, the plan B of compulsory masks, vaccine passports and more home working.
At the moment, the data does not suggest that we should be immediately moving to plan B, but of course we will keep an eye on that.
In fact, we can reveal the government's health security agency has been urgently canvassing council's opinion on the rollout of a plan B. We've seen an email sent to councils on Friday morning asking for news of the situation on the ground where they are and their views in respect of the current debate about plan B. The email wants to know by the end of the day whether councils would support additional measures at this stage and what measures they'd want to see. Labour says it is time for tighter restrictions.
The scientists and SAGE are now saying that mandating masks in public places, on public transport and in shops, and also working from home more flexibly could help get control of this virus.
So you want Plan B to come in now, do you?
We want those measures alongside actually getting the vaccine rollout working properly again. Only 17% of 12 to 15-year-olds have had the vaccine.
At this doctor's surgery in South Cumbria, they're trying to catch up with children like Lola Yassine, who missed the jab in school.
When she's back at school, hoping that if she does get COVID, she gets a very, very mild version of it and hopefully, doesn't pass it on to us as adults.
It's thought the government wants to wait and see what the COVID data is like after the school break. But for now, Downing Street maintains there is spare capacity in hospitals. Yet A&E doctors warned today 12-hour waits are now the highest ever because there aren't enough beds.
COVID is what I would say is a heavy straw on the camel's back. Remember, we were having winter crises in the NHS before COVID came along. What COVID has done is it has totally taken about 5% of the bed stock out of the NHS for acute hospitals and provided a bunch of other people who would be in hospital who wouldn't otherwise be. So we have lost, at the moment, 1 in 5 of our intensive care beds because of people being occupied with people with COVID. So there's no slack in the system. Something's having to give.
COVID rules could make a comeback, but the Chancellor's shut the door on the furlough scheme, insisting Plan B does not involve significant economic restrictions.